Hopefully you got a chance to watch the review on Khan Academy to go over the different types of heart failure, left versus right, systolic versus diastolic, to help you understand the background a little bit better. So as you watch that, you know that this is not only a pump issue or pumping, it's also a filling issue. So systolic versus diastolic. And if you didn't watch that video, make sure you go back and watch it. I just think it's a really good overview. So what's the most common cause of congestive heart failure? Well, the most common cause is hypertension or long-standing high blood pressure over time. There are, of course, other causes, but that is the most common cause. Also, pregnancy, there is a rare chance, although it has happened, that females post-pregnancy can end up with some congestive heart failure also. Usually it becomes resolved. So how is it diagnosed? Well, first of all, we have to take a really good history, and we will go to this slide here to show you the different types of symptoms that the patients have. So they can start feeling fatigued and short of breath. So I'm going to write down the most common ones that we see. That's dyspnea. So get really short of breath with exertion and at rest, and orthopnea. So you're basically need to sleep with your head of the bed up because you are so congested and so short of breath. And as you can see, it depends whether it's the right-sided versus the left-sided failure. As you learn, the left side usually can turn into the right side. It can be both right and left. But most commonly, it starts with left-sided heart failure, and fluid backs up into the lungs if it's left-sided heart failure because that is where the blood is coming from. Remember in the video, it had mentioned like a traffic jam. So if blood is backed up or there's a traffic jam, then it's just going to get backed up from where it came from. It's trying to get to the body, but it's not able to pump out efficiently. So it gets backed up in the lungs. Well, these people end up having these symptoms over here, where at night you're waking up gasping for air, and with that, when it gets really bad, you get confusion. But I would say the most common earlier signs are fatigue, dyspnea on exertion, and having this pulmonary congestion, which would mean you can't sleep very well at night because you're really short of breath. So that's a sign. Versus right-sided heart failure, remember the traffic jam is getting backed up into your organs, so then you have organ congestion, which again, you're going to have fatigue. But this is where you have the leg edema and hence weight gain. So it's very close monitoring. If you get a really good history and you can get a chest x-ray, that can indicate that there's some vascular congestion going on and congestion in the lungs that mimic or show, I should say, heart failure. And then the next thing is to get an echocardiogram because we need to see what is going on with the pump of the heart. You see each of the chambers. How are the valves looking? What's the thickness of the ventricle? If you remember the right-sided heart failure, the ventricles are thick. With left-sided heart failure, if it's a diastolic issue, then the ventricles are thick in the wall of it, whereas if it's a systolic issue, then the walls are thinner in the ventricle. It's just not able to pump as efficiently. So when you do an echocardiogram, and you do not need to know this for the exam, but just to let you know, we do check what's called an ejection fraction. So that's the amount of blood that's pumped out, and it gives a percentage. The most common average is about 55 to 70% ejection fraction as normal. There's been some varying from 50 to 69%. So what that tells me, if someone has an ejection fraction of 30%, that tells me that their heart is not pumping efficiently, and there's most likely some systolic heart failure. But if you have a diastolic heart failure, remember, you're able to still pump blood out. It's just the walls are just thickened. So although it's still able to pump out efficiently, so at, say, 58% ejection fraction, they still can have some diastolic heart failure because it's still going to pump out as efficiently. It's just not pumping out a lot because remember, those walls, the muscle walls are so thick, and so it's not filling up enough. Okay, so how are we treating these patients? These people, the goal is to keep them out of the hospital. We do not want them to get in the hospital, and because number one, they're going to get more sick. Number two, insurance coverage, they're sedentary, and many other reasons. But what we need to do is talk about education and prevention. So when they're at home, they need to be weighed daily. And of course, if they come in with what we call a congestive heart failure exacerbation, we're giving them diuretics. These people are getting loop diuretics, so that would be your Lasix. And remember, that depletes your potassium, so you need to really monitor that. So sometimes these people need to get a potassium supplement while they're being treated with the furosemide or the Lasix, as the brand name furosemide's generic. They need to be weighed daily. You need to watch their fluids and sodium. They should be exercising while they're at home and watch their food intake. So monitoring and having a diary is super important for these people at home. Diary of what food they're eating, because it's really easy to not keep track if you're not writing it down. And you need to monitor your weight. So you need to weigh yourself every single morning at the same time. If you gain 3 pounds within the 24 hours, that's a sign that you're retaining water. Or 5 pounds in a week. So that's why it needs to be written down, and so you can look at the trend. Because that tells me then you may be having some heart failure issues that are exacerbated. So to go on about preventing exacerbation, these are some things that cause or are symptoms of exacerbation or can cause an exacerbation, such as stress, heart arrhythmias, atrial fib, or atrial flutter. Because remember, the atrium then is fluttering or fibrillating, and the blood is not going to be pumped as efficient. So that can put them into an exacerbation. Also, illness, if they've been sick, especially, let's just say, with a cold, a viral infection, a respiratory infection. If they have a poor diet, so they're not getting enough iron, they're not getting just enough nutrition overall. You don't want the patient to become anemic, because remember, with anemia, the oxygen sits on the hemoglobin, and if you're anemic, then you're not getting enough oxygen to your body. So someone with heart failure, you want to make sure that that's controlled and we're not having any issues with that. Fluid overload, maybe they're drinking too much water or too much salt, not enough to balance it out. So they have to be really careful. We push water with everybody, but with heart failure, especially in the latter stages of it, you have to be really careful. Control their blood pressure. Hypothyroidism. Hypothyroidism can have an effect on our entire metabolism, so we want to make sure that that's controlled. So, in summary, close monitoring is key, working together as a team, preventing exacerbations, and preventing in the first place, which brings us back to hypertension last week. I just want to go back really quickly to this slide. So let's just say the patient's inpatient. They're most likely getting IV Lasix, which I had mentioned. They're going to be getting labs every day. You're going to be weighing them every day. You're going to walk them around. They're going to be walking around the nurse's station. They're going to be monitoring their food and their fluid intake, and making sure the head of the bed is up at least 30 degrees to help prevent the orthopnea and the shortness of breath. The patient may have oxygen on, but once they start improving, sometimes they put them on oral Lasix and possibly send them home with that. And that's when they go home with this regimen. Again, it's just done in a different fashion. They're doing this stuff at home, and they have to be more accountable, so that's why education is important. All right, and that is it.